when those are available. We've just popped a disclaimer in the chat there about the recording. We're aware that this is a long day in terms of being on Teams. We're really hopeful that this is an informative and insightful day. We've got a real mix and range of interesting speakers. We understand that not everyone can stay with us for the whole day, so we do anticipate people kind of dropping in and out. So I will try as far as I can to stick to the times in the agenda, just so that if people are joining us for specific sessions, that we're keeping to time. But do feel free to drop in and out if you need to. We do have a couple of breaks throughout the day as well, but the benefit of being online is that you can stretch, grab a drink, what have you. So please do stay with us for our range of different speakers. So without further ado, this is our agenda. It is a packed agenda. We've got a huge range of topic areas to cover throughout the day, and thank you to our external speakers who have joined us as well. Kind of sprinkled throughout the day is our benchmarking findings. So we're covering quite a lot of the different areas of mental health, learning disabilities and autism benchmarking that we do. Like I just said, we will have 2 breaks throughout the day. So we will break for half an hour for lunch, and we will have a comfort break in the afternoon as well. As I've mentioned a couple of times, this is the first time that we've sort of trialled a full day event to cover as much as we possibly can. So we do appreciate any feedback that you have on any element of our service, but in particular the event today. We will be popping a link in the chat to our feedback form, and would really appreciate people filling that in, just so that we can learn for future events of this kind and understand what works, what doesn't, etc. So thanks everybody. So before I pass to our first speaker, I just wanted to take the opportunity to introduce us here at the NHS Benchmarking Network. Hopefully quite a few of you will be familiar with who we are and what we do, but for those of you that are new to events such as this, or to the NHS Benchmarking Network as a whole, just a little bit of an introduction to us. We are a UK-wide impartial member-led community of health and social care organisations. We are celebrating our 30-year anniversary next year, which we're really proud of. During that time, we've worked really closely with health and care organisations across the UK and beyond, to really support organisations, services, systems to support data-driven decision-making. And we're really pleased to be able to continue that work, hopefully into the next few years as well. We are values driven. We are very proud of our values of excellence, respect and integrity, and we really are focused on enabling our members, our users, our stakeholders to use data, use benchmarking, use the opportunity to share information and learning, to ultimately improve patient outcomes and raise health standards. And we're able to do that through our unique impartial position and working with you as individual organisations and individual users. In terms of what we actually do, in a nutshell, we provide data insight services to support organisations, support services to better understand those services that they are providing, that you are providing. We provide that impartial challenge, comparison and learning opportunities. But in a nutshell, we kind of source data, whether that be through national data sets or predominantly through unique data sets and data that we're collecting from providers. We take the time to curate that data, to cleanse it, to validate it. We then analyse that and visualise it in a way that enables our end users to be able to gain insights and make changes and identify areas of opportunity within their own organisation. Our offer is currently focused around various different programmes of work. So our member programme is where it all started 30 years ago, with a group of organisations coming together and wanting to compare their services. And we've continued to do that and to support organisations in that way. And quite a lot of the insight and the data that you'll see this afternoon and this morning from the team has come through that membership programme. The member programme enables organisations to take part and benefit from a range of opportunities around benchmarking and data collection at quite a low cost, really, due to the collaborative nature of kind of all putting in to be able to develop that programme of work. And we're particularly proud of the mental health benchmarking that we do, which is quite unique in terms of its granularity and the purpose and the usefulness of that on the ground. Kind of alongside the core member programme, we also collect workforce information within our workforce programme, again predominantly around roles within the MHLDA sphere, and you'll hear some more around that this afternoon as well. And we also run some national clinical audits, and we'll have Joy Lynn with us later on today talking through a mental health spotlight audit that we're currently running within the National Audit for Care at the End of Life that we run on behalf of HQIP. Because of all the work that we do throughout these programmes, we are in a really unique position to be able to utilise our kind of benchmarking and data collection and validation processes to support organisations, systems, regions and collaboratives in a more bespoke way in terms of additional benchmarking and analytics services as well. So if that is anything that you're interested in the future, please do get in contact with us just to see how we can best support you and your organisation and the services that you're delivering. In terms of some of the data that you will see throughout the day, like I said, it does come predominantly from our member programme, and as a member of the network, you would have access to a range of different data sets, different resources, different support. If you're not sure whether your organisation is a member or not, we can pop a link in the chat so you can just check. And if you have any queries around your membership or you need a login to access our resources, please do get in contact with the team and we can get that set up for you. In terms of the outputs, from the findings that we'll be presenting throughout the day, you'll be able to access all of the data and more through our members area, through our online data explorers, through the reports and the shared learning compendiums. And like I say, if you need a login, please do get in touch and we can get that set up for you. And finally, we do have a number of other kind of insight and networking events. And at the end of the session, I will share a link to find out other opportunities for you to get involved and to come and view some of our additional findings. So thanks for listening to that introduction. Hopefully we're right on time. So I am going to pass over to our first speaker of the morning, Kadra, who has joined us from the Centre for Mental Health. So thanks very much, Kadra. I'm going to move on.
Wonderful. Good morning, everybody, and thank you, Emma, and to the Benchmarking Network for inviting me here to speak today. I'll be delivering a State of the Nation overview this morning based on our assessments at Centre for Mental Health. Just a little disclaimer from me to say that most of our influencing work focuses on England, but I do hope many of the messages and insights apply or resonate to colleagues working across Wales, Scotland, and Northern Ireland. Next slide, please. So before I kick off, I just thought I'd introduce Centre for Mental Health for those of you who aren't familiar with us. We're celebrating our 40th birthday this year. Essentially, we are an independent charity that was set up to help bridge the gap between policy, research, and practice. Over the years, we've sort of fine-tuned our strategic focus to look at tackling mental health inequalities in particular, and we look at this across the life course. And the work that we tend to do at the centre involves generating a lot of community-based research, service and program evaluations. We use some of that insight to then help us with policy influencing and campaigning work. And we also convene a number of networks that might be of interest to people in the audience. If you're interested in any of that, I can share some links. But for example, we host the Children and Young People's Mental Health Coalition, which brings together around 450 organisations who campaign on the better mental health of babies, children, and young people. We also host a network called Equally Well, which is about trying to address that mortality gap for people living with severe mental illness by driving better outcomes for their physical health. So that's a little bit about who we are. Next slide, please. And then the next one after that. So in the first part of this presentation, I'm going to draw largely from the Big Mental Health Report. This is an annual collaboration which we launched for the first time last year with our partners at Mind. Essentially, this is our State of the Nation report where we try and bring together all of the latest research, grey literature, data that's available to paint a picture of mental health in both England and Wales. And we also work together to survey the public through the Big Mental Health Survey and the Attitudes to Mental Illness Survey, which kind of builds on some of the previous work around the Time to Change campaign. So we're looking in this report annually at what's improving, what's getting worse, and what needs urgent attention. And we're also using this as a bit of a tool to hold the governments to account in terms of some of their commitments around mental health. So I will share a link to this. We published this 3 weeks ago, so still slightly hot off the press. We're also hoping to kind of use it as a tool to connect some of that national evidence with local decision making. So we hope if we have any commissioners in the room that this is useful to you from a sort of strategic planning and commissioning perspective. So next slide, please. So we've seen the prevalence of mental ill health increase across all age groups in recent years. But this summer, for the first time, we saw the much anticipated publication of the Adult Psychiatric Morbidity Survey, which helps paint a picture of mental health problems amongst adults in England. And this was the first time it was published for nearly a decade. So when we look at common mental health problems such as anxiety and depression for adults, we've seen that this has increased slightly from 1 in 6 adults affected by these difficulties to now 1 in 5. There are some quite significant inequalities worth bearing in mind, and I'll come to some of those in a moment, but clear gendered differences with rates higher amongst women. And young adults are particularly affected with prevalence increasing quite sharply for that age group. This also mirrors some previous data for children and young people we've seen from NHS Digital, which shows that 1 in 5 young people report a mental health problem compared to 1 in 9 in 2017. So I'm sure these figures are quite familiar to yourselves, but we are also expecting, I think later this year or early next year, some further analysis from that adult survey looking at severe mental illness and areas such as substance use as well, which yeah, will be interesting to see what's changed there. Next slide, please. So I mentioned that there are some really stark and enduring mental health inequalities that are worth highlighting. Amongst those most at greater risk, we see that adults with physical health condition are much more likely to report a mental health problem. People experiencing poverty or financial security are also faring worse. with rates higher in areas of greater deprivation, unsurprisingly. The report this year also looked at problem debt. So people experiencing problem debt were twice as likely to report a mental health difficulty. And this also builds on some previous evidence showing that children and young people growing up in these circumstances are also much more likely to face mental health difficulties. There are also lots of other groups that aren't captured in these slides. For example, people from racialized backgrounds experiencing greater levels of distress in some domains and areas too. Next slide, please. So now looking at people's experiences of support, we actually drew on the benchmarking report from last year, which showed that there was quite a significant rise in referrals to mental health services. And this is, a general trend we've seen in recent years. I'm curious to see if that is still the case in this year's report a little later. We know that also waiting times are unacceptably long across all ages, really, but children and young people and older adults also faring worse. And this was really captured in Lord Darzy's independent review of the NHS last year, where he described long waiting times as being normalised within mental health services. However, using new data this year in the Big Mental Health Report, we also looked at people's experiences of support while they were waiting, looking at areas such as GPs and the voluntary community sector and digital platforms. According to those who responded, around a third of people felt that the support that was available to them didn't meet their needs. And in particular, people kind of shared some reflections with us around their perceived sense of unfair treatment, particularly from GPs. And all of this, I think, to us sort of emphasizes the need for joined up local coordination and investment in early community-based support. Next slide, please. Another sort of worrying finding, which we emphasized in this year's report, is looking at people's understanding of mental health, which is slipping back, unfortunately. And at the same time, we're seeing stigma creep up. So as part of this year's report, Mind commissioned, I mentioned the survey looking at people's perceptions around mental health. Really worryingly, fewer people this year felt that they would feel comfortable working or living near somebody receiving mental health care. And in particular, stigma remains strong for people living with severe mental illness. So, for example, around schizophrenia, I think there was a quite increase there in terms of people's perceptions around people with schizophrenia being of danger to others. So there's been an increase in the numbers of the public agreeing with that statement. So this means that while we have made some progress around mental health awareness, it does really need to be matched by some renewed efforts on mental health education, inclusion, and tackling prejudice at all levels. Next slide, please. We know so the costs of untreated mental health difficulties are significant. Some analysis we published last year puts this as at around 300 billion a year. And this looks at the economic costs, so the loss to the economy because of mental health problems. This includes things like business costs relating to sickness and presenteeism at work, as well as staff turnover and unemployment. We also look at the human costs, so the value expressed in sort of monetary terms around reduced quality of life for people, premature mortality for people living with mental health difficulties. And then, of course, the health and social care costs, which are around 60 billion, looking at the provision of services. And this is, when you put this into context, is really significant. But whilst mental illness continues to account for about 20% of the burden within the health system, it still receives 10% of expenditure within the NHS. So really emphasizing that lack of parity in spend. Next slide, please. So one of the areas of great interest in relation to the mental health impacts and its impact to the economy is young people who are falling out of the labour market. There's lots of national conversations and press coverage, I'm sure you've seen around this. So I just wanted to touch on this issue a little bit. So we know from some of the data released earlier this year that youth economic inactivity is at an 11-year high. More young people are out of work and education than at any point over the last decade. And this really coincides with that sharp rise we've started to see in health-related benefit claims. So over 4 million working adults now are claiming with mental health and behavioral difficulties being cited as a factor in half of those cases. But we've really seen that there's been the steepest rise amongst young adults who are 16 to 25, where this rose from 4.9% in 2019 to now 7% in 2023, 2024, likely to be even higher in the last financial year. From our perspective, we know that mental health and economic exclusion are deeply linked. Young people with mental health problems being five times more likely to be economically inactive. So really, it's a cyclical problem where poor mental health without the right support can lead to unemployment, and insecure, low quality work for young people can also worsen their mental health. So in this area, we do particularly need joined up efforts across health, education, and workplaces to help break that cycle. So we were pleased to see the government announced earlier this week a review by Alan Milburn looking at why young people are out of work. And we'll be following this quite closely and sharing some of our insights in relation to what works for young people's mental health. Next slide, please. And related to this, is our Future Minds campaign that we've been running in partnership with Centre for Young Lives, Young Minds and the Children Young People's Mental Health Coalition, where we're really trying to champion this investment case in prevention and early support for young people, and trying to make the case that this not only enables young people to thrive, but is also an economic and moral imperative given the current circumstances. Next slide, please. Beyond issues relating to young people out of work, we also know that there's been a lot of debate and skepticism at the moment around whether the rises in mental ill health nationally is real or not, or, are we over-diagnosing? Are we over-medicalizing everyday distress? And we're seeing some of these comments coming from leaders from across the political spectrum and across different systems. So in this year's Big Mental Health Report as well, we really wanted to dive into what the evidence is telling us around some of the drivers of this phenomena. So firstly, it's fair to say, I think we're seeing the long-term effects of austerity, and there's a lot of literature pointing to this, how financial inequality, insecure living conditions are closely associated with poor mental health outcomes. And again, these create a vicious cycle. Over the last couple of decades, we've also seen significant reductions in benefits and a shift towards more punitive social security measures. And this has disproportionately impacted people living with mental illness. When we look at policies such as the changes to universal credit, the work capability assessment, rising pension age, housing benefit changes, and the two-child limit, although it sounds like there might be some positive announcements coming in the next couple of weeks around that. We've also sadly seen severe cuts to public services in areas such as public health and also youth services, where funding for the youth sector's gone down by 70% since 2010. And this really impacts the ability for services to provide high quality, community-based early help and prevention services. And compounding all of these issues, we know are a number of structural factors impacting people's mental health. So poverty, we've touched on discrimination, a lack of belonging. These are all key drivers, not just individual circumstances. So for all mental health providers, obviously, and partners, this means we need to work together to look at tackling some of these wider social determinants. Next slide, please. And then the next one. Thank you. One of the key bits of policy we've been working on over the last year is the Mental Health Bill. So we know that the Mental Health Act is 40 years old and was in serious need of reform to address some of the enduring mental health inequalities that exist in its application, particularly for Black people, autistic people, and those living with learning disabilities. So we were really pleased to see it finally introduced over the past year, and have been working to ensure that people's rights and protections were embedded as part of it. So some of the progress we've seen, which the bill is currently in its concluding stages, is the introduction of advanced decision making for people who live with severe mental illness and at risk of admission, that they're able to sort of express their feelings and wishes for what their care could look like, and hopefully that leads to more joined up care planning for them. The bill also mandates an offer of independent advocacy services for people detained under the Mental Health Act, which we think is a really positive move. It also includes provisions around care and treatment plans, so looking at people's lives holistically, their housing circumstances, their home, their education, and all of that being factored in their sort of plans. Positively, and this is something we've in particular been advocating for, is time limits to be introduced on community treatment orders. So these are the measures to enable people to be looked after outside of hospitals and into the community with some conditions. Currently, people can be on them up to a decade, we've heard about in some cases. So it's really positive that the government are putting in some parameters to review those quite regularly with people. And also a limit on prison to hospital transfer. So we know that we have got a mental health crisis in our prison system at the moment, and lots of people are sadly left there to languish and not able to readily access the care they need in hospital. So there's an introduction of a 28-day limit there. However, there are some ongoing gaps and challenges which we've highlighted. So, for example, making the Mental Health Act reforms work for children and young people. We've been especially worried that children could be doubly disadvantaged on the basis of their age, being undermined in terms of decision making, but also because of their mental capacity. So we really need to make sure children have a voice that is just as, considered as adults in these circumstances, and also around race equity. So the bill as it currently stands, whilst tackling racial inequity was a big impetus for introducing it, it doesn't actually mention it anywhere in the face of the bill. So we'll see what that process of implementation and guidance development looks like over the coming months. Next slide, please. Over the summer, we've also had the launch of the 10-year plan for health, pardon me, which looks at reform across the health system on the whole. And we know that this is also launched in the context of the abolition of NHS England. So there's a lot of like reconfiguration happening nationally to help deliver this plan in some ways. Overall, I guess our perspective is that it could have gone a lot further with regards to some of its commitments around mental health. But I just wanted to touch on some of the key measures that are outlined in it that's worth knowing about if you're not already aware. So firstly, this shift towards neighbourhood health is really positive from our point of view. So taking that more hyperlocal approach. And we know there was some work done in this space a couple of decades ago. So in some ways, we are kind of going back and building on some of that learning. But, we know that local decision makers are ones that are best placed to kind of work with their communities to shape and design their services. And we're really interested to see what that looks like for mental health. I can share our CEO recently produced a briefing around the opportunities around neighbourhood health for mental health for anyone that's interested. There's also some work to develop a modern service framework for mental health. I believe it will be initially starting with severe mental illness as an area to make sure that there are some consistent standards in practice and offer for people to end some of the ongoing postcode lotteries. Something that we've also been slightly worried about is a commitment to introduce mental health emergency departments. We don't really know quite what drove this commitment or the evidence base around it. So we'll be really interested to see what that looks like going forward. And then some sort of positive commitments to continue to invest in and expand in some of the ongoing programs of work, for example, individual placement and support to support those with mental illness back into good quality work, and for children and young people to continue that rollout of mental health support teams in schools. And a new model is also around Young Futures Hubs, which are early support centres where young people can access immediate advice and support around mental health. So those things are quite positive. In terms of gaps, there really wasn't much in there around how the government will achieve some of their aspirations around parity of esteem, particularly around waiting time. So there's a big emphasis on physical health, wait times, and mental health is forgotten as part of that. Nothing in there really around how we will continue to sustain and ensure that mental health receives its fair share of funding. And then continued growth of the mental health workforce wasn't really highlighted in there as clearly as it could be. And then there were some other areas we flagged as gaps, for example, mental health in later life, lack of commitment to the patient and carer race equality framework, and also a broader sort of focus on primary prevention and the need to work with councils, social care in particular, third sector partners, and communities that are led by and for groups. Next slide, please. I did want to kind of highlight these neighborhood mental health hubs, which also sometimes are known as 24/7 pilots. So this is a positive shift and looks to sort of build on some of the developments and work in the Trieste region in Italy. And this is to try and identify opportunities to have alternatives to A&E admissions for people who are seriously unwell. We are currently involved in the evaluation of these pilots with Ipsos Mori and UCL. So there are 6 areas across England that are piloting this. This includes Cumbria, York, Sheffield, Birmingham, Tower Hamlets in London, and Lewisham in South London. So our understanding is the 6 areas have come together to develop a set of shared principles, but each of them are developing with their communities slightly different models and approaches. And I think Tower Hamlets have been a bit more advanced in terms of opening up their services at the moment. So it's worth looking at. Next slide, please. I also thought it would be helpful to share some of our initial reflections on NHS England's medium-term planning guidance for integrated care boards, which was released a couple of weeks ago. Overall, I guess it was slightly disappointing from a mental health perspective. I mentioned there is those commitments to continue the expansion of programs such as mental health support teams, NHS talking therapies, and individual placement and support. It did also include some commitments to invest in those mental health emergency departments, which we'll see what those look like going forward. But there were some significant gaps, and something we're looking at the moment is whether the mental health investment standard is being kept as is or whether it's at risk of being redefined or diluted. We're hoping there's some more information on this coming out, but we know that this has served as a really important ring fence for mental health spending. We've not seen anything in there around access and waiting time standards. And our understanding in relation to children and young people is that some of the access targets are missing from the guidance, so signaling a bit of a deprioritization there. Youth Futures hubs was spoken about in the 10-year plan, but there wasn't any great commitments in the guidance around this. We've also seen the loss of some clear guidelines around annual physical health checks for people with severe mental illness. And again, I mentioned the patient and carer race equality framework was missing from this year's guidance. Next slide, please. And the next one after that, thank you. So in terms of what is on the horizon, it's great to see that accompanying the 10-year plan, there will be a 10-year workforce plan, and the consultation for this actually closed last week. We're really keen to make sure, there's a specific focus given to the mental health workforce, but that we also look beyond NHS services and think about partners in councils, the voluntary community sector, digital providers, and how can we take a more comprehensive approach to mental health workforce planning. We know that there are lots of ongoing reforms affecting integrated care boards as they become slightly bigger. And we're expecting some reforms to the way councils operate and the numbers of councils. This can either be make or break for mental health, but we'll do what we can to continue to push for joined up thinking there. In relation to some of the debates around overdiagnosis in mental health, we are also expecting a review to be announced, an independent review to try and understand what's driving the rise in mental illness and neurodiverse conditions with a sort of particular focus on conditions such as ADHD. So we'll be quite keen to feed into that and encourage you all to do the same if you have the opportunity. And we know there's a lot of work happening looking at mental health work and the social security system. So last week we saw the publication of the Mayfield Review, which outlined a number of recommendations for workplaces. And we're also expecting the Timms Review, which is looking at social security changes and the impact that might have on people with disabilities and mental illness. Next slide, please. And one after that, thank you. In terms of where do we go from here? We have a number of calls that we think can really help propel and take forward the 10-year plan even further. So something we've been advocating for across all 4 nations actually is the embedding of mental health in all policies approach through across government strategy. So this would include adopting a mental health policy test where in each area of policy making, the impact on mental health is thoroughly considered and acted upon. We also want to see the guarantee of fair funding for mental health across all parts of the system. So not just for the NHS, but thinking about councils and community sector organisations, the education system, and so forth. We want to see investment in the workforce, looking at boosting capacity, skills, and the diversity of it. We want to see a real commitment and a shift of focus towards prevention and promotion, the need to tackle stigma, which I mentioned is worryingly creeping up, and supporting well-being across the life course. We want to see a maintained and sustained focus on equality, so looking at programs such as the Patient Carer Race Equality Framework, tackling hidden forms of inequities, particularly those affecting older adults and LGBT communities. And then lastly, I just wanted to reshare, I believe our CEO, Andy, shared this on the next slide, please. Last year, our comprehensive vision for what we want the world to look like from a sort of mental health point of view is all outlined in this Mentally Healthier Nation, where there's 3 sort of key pillars to this: the development of a mental health plan, mental health test I mentioned earlier, and also a mental health commissioner, particularly for England, because we do not have this, that can keep track on all these reforms and policy developments to ensure that they are joined up, unified, and making a difference for people on the ground. Thank you. Next slide, please. And then just finally, a bit of a plug in terms of how Centre for Mental Health might be able to support you in your work. So we do quite a lot of local strategic support, undertaking things like needs assessments, complex system mapping, working with people to develop and co-develop with their communities' mental health strategies. We also, I mentioned the Mentally Healthier Systems Network, System Leaders Network. If anyone's interested in that, is a bit of a shared, closed peer support space for people working in integrated care boards. Equally well, I mentioned, and yeah, just generally, if there's anything else you feel we could help you with, that's my email. And yeah, I think I am done. So happy to take any questions. Thanks.
That's great. Thank you so much. Lots and lots of information in there and lots of food for thought. I have been keeping an eye on the chat. There have been a few comments and questions in there that I'll pick up now. But if anyone wants to raise their hand and ask a question directly, we can pop your mic and camera on. Renee was asking, is there a reason why you're England focused rather than the whole of the UK? And do we know sort of how applicable it would be to sort of the other home nations?
Yeah, good question. Purely because of capacity. So we are a small team. We are 22 in the organization, and currently it's just me and our policy team. So in terms of being able to service all the nations in a meaningful way, unfortunately, we're unable to do that. But we do work across the 4 nations where it's related to specific projects. So One example is we've done some work for the Pilgrim Trust, evaluating a program of work looking at young women's mental health that covers England and Northern Ireland, for example. So we're working with partners there to understand the policy context. So yeah, purely for for that reason. But we're always really interested in collaborating with partners across the UK. With regards to the research and the stats, I would say some of it is applicable across the four nations, but I was in Belfast, for example, yesterday with colleagues from the Northern Ireland Assembly, and I know that they have, the highest rates of mental illness across the UK. So there are some nuanced differences, and some of the social drivers may also be slightly different. I hope that answers that question. Yeah.
Lovely, thank you. Oh, we've got a hand up. Can one of the team just support with up in the camera and then my on? Lovely. You should now be able to take yourself off mute.
Cheers, thank you. Thank you very much. It was myself who asked the question around the other home nations. I was just wondering, because obviously the slide pack's going to be shared afterwards, but I couldn't see, all of the bullet points and the stats and all the helpful information you've included. Obviously, is all England based, everything that's in the presentation. It's just because it's really helpful information, but I can't use it in Wales if it doesn't include obviously research or evidence. So I was just wondering how much of the presentation today includes the other nations.
Yeah,
Thank
definitely.
you.
So, yeah, thank you. Great question. So the big mental health report that does cover England and Wales. So all the
Okay, that's
data
really
from
helpful.
that,
Thank
yeah.
you.
And we
Thank
actually
you.
have pull out very clear marked areas throughout the report for Wales. So we worked with colleagues at Mind Cymru on that as well.
Perfect. Thank you so
Yeah,
much.
no problem.
That's great. And is the big mental health report available on your website, Kedra?
Yeah,
Is there a
I'll pop a link in the chat actually if that's helpful. Yeah.
That's perfect, thank you. We also had a question/comment from David at Greater Glasgow and Clyde. Is it possible to be clear regarding the evidence and showing causation for increase in mental health issues and psychiatric illness that requires a specialist psychiatric service response? So maybe more of a kind of reflection rather than a question there, but lots of kind of agreements in terms of the content of the presentation. Another question around, or again, a bit of a reflection around, given that GPs have the additional roles reimbursement scheme and the new roles in primary care, it's still a little bit disappointing at the kind of unfairness, even though there's been kind of investment in that area.
Yeah, no, I would agree with that as well. And obviously, this is people who have an interest in mental health or already known to mental health services. So it's not fully representative of the overall kind of population. So there is that caveat there. But yeah, there's definitely some opportunities. I think, especially with the young people's hubs, for example, in some work in South London, the youth hub, mental health hub in the community is actually set up by GPs. It's called the Well Centre. And they've been really kind of trying to take some of the provision and support out into communities, working very closely with other charity partners. And that's really kind of helped establish strong, trusting relationships with young people and, yeah, ultimately also help address issues earlier and reduce the sort of need for onward kind of, yeah, triaging into mental health services. So as an example of ways that could work and taken advantage of all the focus on neighbourhood health, I think there's really great opportunities there.
Lovely, thank you. Are there any other questions? I think there's a few people quite keen to grab a copy of the slides. Are you happy for us to circulate
Yeah,
those after?
absolutely. Yeah.
Fantastic. Any other questions before we move on? We have got a little bit of time if anyone does have any thoughts or questions. One's quiet so far. I will leave that there then. And if anyone does have any other questions, I think you popped your email address there as well. And if we get any more in the chat, I will forward those on as well. But thank you so much for joining us this morning.
Thank you. Thanks, Emma. Thanks, everyone. Have a good one.
Lovely. Thank you.